Breast reduction and augmentation surgeries require separate consideration in aesthetic procedures. Breast reduction and lift procedures are generally less demanding than breast augmentation surgeries. Recovery from these surgeries is faster and more comfortable. After breast reduction and lift surgeries, the points that patients should pay special attention to are as follows. We allow them to take a bath after approximately 2 or 3 days. Because patients experience almost no pain following lift and reduction, they recover quite rapidly. They can return to their work life within about 4 to 5 days. I strongly advise wearing a sports bra or athletic undergarment for approximately 1 month post-surgery. After breast reduction surgeries, the patient's ability to perform movements, physical activities, or return to social life is quite fast. Within about 4 to 5 days, patients can resume all their normal social activities. An average of 10 days to 2 weeks is needed to be able to do sports comfortably. After 10 days to 2 weeks have passed since the surgery, if the patient wishes, they may swim, play tennis, or even engage in weight training if they so desire. Therefore, I want you to know that the post-operative period of breast reduction and lift surgeries is very comfortable. I want you to know that you will recover fast and return to your social and professional life quickly. There are a few distinct points we must be careful about in breast augmentation surgeries. Particularly in the early stages following breast reduction procedures, we have no restrictions regarding hand movements or movements made from the elbow. However, there is no problem with movements made from the shoulder up to 90 degrees. In movements exceeding 90 degrees, the pectoral muscle in our chest area contracts significantly, which inevitably causes pain for this patient. It can inevitably lead to problems in the placement of the silicone implant we use. Therefore, in the early period, that is the first 10 days, we do not want movements above 90 degrees from the shoulder, and we restrict them. After 10 days to 2 weeks have passed since the surgery, we will be able to go above 90 degrees slowly and gradually. In breast augmentation surgeries, there will be some massage movements that the patient needs to apply 2 weeks after the surgery. During our checkups, we will demonstrate how to perform these massages, their frequency and intensity, during the second week to our patient practically. In our third week checkup, we will continue by increasing the intensity a little more. We will continue our massages for approximately 1 to 1.5 months. Especially after breast augmentation surgery, we allow light sports such as walking or low tempo running after 2 weeks. However, we need to wait approximately 4 weeks for sports that are more intense and require more effort. Once 4 weeks have passed since the operation, the patient may engage in any sport they wish, including swimming or tennis. Notably, in breast augmentation, patients often ask about sleeping positions. They should generally sleep on their backs post-surgery. However, I also allow them to lie on their sides or on their right or left arms. But one must be careful here. When lying on the side, we should not touch the breast too much. After 1 month has passed since the surgery, the patient can even lie face down. This does not cause any problems for us or any issues as a result of our surgery. In summary, breast reduction and lift surgeries are surgeries where we will heal very quickly and adapt to our social life very fast. In breast augmentation surgeries, we need to show a little more attention and a little more care. We also need to be slightly more patient regarding social and sporting activities.